Have you ever wondered what happens when the bone marrow fails to produce enough healthy blood cells? Welcome to our deep dive into the intriguing world of myelodysplastic syndrome. This condition, often simply referred to as MDS, is more than just a single disease. It's a group of disorders, all linked by one common feature: the bone marrow's inability to produce enough healthy blood cells. Imagine your body as a bustling city, and blood cells as the diligent workers keeping everything in check. Now, what if those workers were poorly formed or just didn't function as they should? Complications would inevitably arise, right? That's precisely what happens in MDS. The blood cells, which are malformed or dysfunctional, can't perform their roles effectively, leading to a myriad of issues. We've only just scratched the surface of this complex condition. But don't worry, we're about to delve much deeper into the fascinating yet challenging world of myelodysplastic syndrome. So, stay tuned as we delve deeper into the world of myelodysplastic syndrome. So, what causes myelodysplastic syndrome, you may ask? Well, the answer is not as straightforward as we might like. Myelodysplastic syndrome, or MDS, is a complex disorder with a multitude of potential causes. Let's delve into some. At its core, MDS is a disease of the bone marrow, where our blood cells are produced. It's believed that genetic mutations within these cells are the primary drivers behind the development of MDS. These mutations can be inherited, meaning they are passed down from our parents, or they can be acquired throughout our lives. Acquired mutations are often the result of exposure to certain chemicals or radiation. For example, individuals who've been exposed to benzene, a chemical found in gasoline, rubber, dyes, detergents, drugs, and pesticides, have a heightened risk of developing MDS. Similarly, those who've had radiation therapy or chemotherapy for other types of cancer are also at an increased risk. Another potential cause of MDS is smoking. Yes, you heard it right. The harmful chemicals in tobacco smoke can cause mutations in the bone marrow cells, leading to MDS. Certain medical conditions can also predispose an individual to MDS. For instance, people with a history of aplastic anemia in which the body stops producing enough new blood cells have a higher risk of developing MDS. Furthermore, age plays a significant role in the onset of MDS. It's more commonly diagnosed in people over the age of 60. This could be due to the accumulation of genetic mutations over time, or other age-related factors. But here's the tricky part. Despite these potential causes, the exact trigger of MDS often remains a mystery. In many cases, it's likely a combination of factors, rather than a single cause. So, to wrap up our discussion on the etiology of MDS, it's important to remember that while we can pinpoint certain risk factors, the exact cause of MDS is often elusive. Although the exact cause may not always be known, there are several factors that can increase the risk of developing myelodysplastic syndrome. Now, let's explore how myelodysplastic syndrome affects the body. Myelodysplastic syndrome, or MDS, is a group of disorders characterized by the bone marrow's inability to produce enough healthy blood cells. To fully understand this, let's first take a look at what normally happens in the bone marrow. This spongy tissue inside your bones is like a factory, producing red blood cells, white blood cells, and platelets. In a healthy individual, these cells are produced in a controlled, orderly manner. However, in the case of myelodysplastic syndrome, this process goes awry. The bone marrow begins to produce blood cells that are immature or dysplastic. These cells are not fully formed and are unable to function as they should. As a result, there's a deficiency in healthy red blood cells, white blood cells, and platelets. Each type of blood cell plays a crucial role in our bodies. Red blood cells transport oxygen, white blood cells fight infection, and platelets help with clotting. So, when there's a deficiency in these cells, the body begins to feel the effects. A deficiency in red blood cells, or anemia, can lead to fatigue, shortness of breath, and a pale complexion. A lack of white blood cells, known as neutropenia, can result in frequent infections, as the body doesn't have enough soldiers to fight off invading bacteria and viruses. Finally, a decrease in platelets, or thrombocytopenia, can lead to easy bruising, prolonged bleeding, and frequent nosebleeds. Over time, these deficiencies can lead to life-threatening complications. In some cases, myelodysplastic syndrome can progress to acute myeloid leukemia, a serious type of blood cancer. So, in a nutshell, myelodysplastic syndrome disrupts the normal production of blood cells in the bone marrow. This leads to a shortage of healthy blood cells, causing a range of symptoms and potentially serious complications. The malfunctioning of the bone marrow in myelodysplastic syndrome leads to a host of problems due to the lack of healthy blood cells. In summary, Myelodysplastic syndrome is a complex disorder with many facets. It's a group of disorders caused by poorly formed blood cells, or ones that don't work properly. The root of the issue lies in the bone marrow, which is responsible for the production of our blood cells. The most common signs and symptoms of this disorder are fatigue and weakness. This is primarily due to anemia or low red blood cell count, as these cells are responsible for delivering oxygen to the body. Shortness of breath, another common symptom, also stems from this issue. Pale skin or pallor is another telltale sign. This symptom is also tied to anemia, as a lack of red blood cells can leave your skin looking less vibrant. Frequent infections are another key symptom, indicating that the white blood cells, our body's primary defense against infections, are not functioning as they should. This could be due to a low white blood cell count or the presence of abnormal white blood cells. Unusual bleeding or bruising can occur, pointing to a problem with the platelets, which are responsible for blood clotting. This could manifest as nosebleeds, prolonged bleeding from cuts, or even petechiae, which are tiny red spots caused by bleeding into the skin. So, how do we detect this disorder? Typical laboratory findings play a pivotal role in the diagnosis. Low blood cell counts, known as cytopenias, are a common finding. This can affect one or more types of blood cells. Abnormal cells in the blood and bone marrow are another key finding. This could be immature cells known as blasts, or dysplastic cells, which look different from normal cells under a microscope. The percentage of these abnormal cells can help determine the severity of the myelodysplastic syndrome. In conclusion, myelodysplastic syndrome is a multifaceted disorder, presenting with a wide array of symptoms and distinctive lab findings. Understanding myelodysplastic syndrome can help us better diagnose and treat this challenging disorder.